In today's video, we're looking at pain on the side of the hip or the lateral surface of the hip right out here on this bone, which is called the greater trochanter. It's a portion of your femur bone, this long thigh bone, and for a long time we used to refer to pain there as trochanteric bursitis. That can still happen in some cases, but the more recent research on it has shown that maybe only 20% of cases are true bursitis. In the other majority of cases, it's now been found that pain there is often due to tendinitis or tendinopathy, as we call it, of the tendons of gluteus medius and gluteus minimus, two muscles back here on the back side of your hip. So in today's video, we're going to look at ways to strengthen gluteus medius and minimus, which will also strengthen their tendons and can get rid of pain. So if you've got pain on the outside of your hip, stay tuned for today's exercises. For all of today's exercises, I'm going to do them as if I've got pain on my left side, so just make sure you reverse everything, obviously, if it's on your right side. So for this first exercise, we're going to be looking at an isometric contraction of gluteus medius and minimus. This is a great place to start if your pain is really acute and severe. Oftentimes, holding a contraction can help to really get rid of pain. So what we're going to do on this one, I've got a band here, a loop band I'm going to put around my knees. If you need one of these, I'll put a link in the description for it. So again, the pain's on my left side. I'm going to sort of hinge down a little bit, kind of stick my butt back like I was going to start doing a deadlift. I'm just going to stick it back a little bit. And then what I'm going to do is I'm going to keep that painful side right in place and put my weight over it and then tap with the other side. So I'm just going in and out and doing these kind of toe taps. Having to hold like this, again, creates this isometric contraction where my muscles are squeezing, but I'm not moving. And isometric contractions have been shown in the research to really help decrease pain when people have tendinitis or tendinopathy. So you're going to go back and forth like this, go for, around 10 to 15 repetitions, and then you can take a break for 30 seconds or a minute, even just switch sides. So I could just switch to my non-painful side and get that one in while I'm resting, and then again, switch back, and you're going to want to look at doing 2 to 3 sets on each side, depending on your sensitivity and your tolerance. With tendon pain, we always tell people when you're trying an exercise, it's okay to have a little bit of discomfort, maybe 3 out of 10. If it's more than that, then the exercise is probably too challenging. You might have to reduce the weight or do less repetitions. The other thing to pay attention to is to look at how you are the next day. If you do the exercises and the next day your pain is worse at rest, then that probably means you did too much or the weight was too heavy. So we always look at tendon pain on a 24-hour window. So just keep that in mind as you integrate these. If these are all new to you, then you might just do one at a time, wait till the next day, see how you're doing. If things haven't flared up, then you know that was okay. Then you could add maybe the second exercise in this video. So, all right, let's get into the next one. For our second exercise, we're gonna do a single leg bridge. I covered this exercise in a lot of videos, but it's because it's really one of the best exercises you can do. When we're talking about gluteus medius and minimus, the single leg bridge has been shown to be one of the best exercises in the research for activating those muscles. So this is a nice one if you've got pain, because we're going to kind of go up and down with the hips and it doesn't put too much stress on the tendons, but it really works them. So you're going to have your hands down at your sides. Again, the pain's on my left side, so I'm going to lift my right leg. My left leg is going to do all the work. And I'm just going to lift up until I've got a straight line from my thigh up to my shoulder. And I'm going to go up and down slowly like that. So I'm just up and down, nice controlled smooth motion, trying to keep my pelvis level, don't let it drop on the other side. So you're just going up and down. And again, because these are all strengthening exercises, we're going to do 3 sets of around 10 to 15 repetitions. And with rest, with these kind of rehab exercises, you can take a rest of 30 seconds to 1 minute, or if you don't want to really have a full rest, just switch to the other side and do the non-painful side. It's always good to strengthen the other side. People ask about this all the time. There's even research showing that strengthening the non-painful side can help to inform neurologically the other side through something called the cross-transfer effect. So you can always do that, and then when that side's done with its 10 reps, just come back to the painful side and just get your 3 sets again of 10 to 15 reps. Always making sure that you have no more than mild pain, 3 out of 10. If it's worse than that, then you're probably not ready for that exercise. For the third exercise, we're going to put a little more load on gluteus medius and minimus and their tendons. Those muscles naturally are abductors of our hip. So they pull our hip out like this. And this is something that's been found in the research, is that people with gluteal tendinopathy often have weak hip abductors. So what we're going to do is take that band from the first exercise, put it around our knees. You can put it on your ankles if you need more challenge. And then what you're going to do, I'm going to stand on the non-painful side and use the painful side to go out into hip abduction. So I'm just going in and out like this, and that's going to really challenge and work gluteus, medius, and minimus. The band wants to pull me into adduction, so my abductors have to control and resist that. So they're going to work concentrically on the way out and then eccentrically on the way in. You can even do a little isometric hold out at the top position and then back in slowly. Really go slow on the way in on that eccentric. That's really important for loading the tendons. So out slowly, hold an isometric, and then in slow. And again, 3 sets of 10 to 15 repetitions. All right, for our last exercise, you're gonna need a dumbbell, something with a decent amount of weight, maybe 10 to 20 pounds. Again, the pain's on my left side. So in this exercise, I'm gonna hold the dumbbell in my right hand. You want it to be in the hand that's opposite the side you have pain. This is called a split squat. So what I'm gonna do, I'm gonna turn so you guys can see. I'm gonna have the painful leg forward. I'm gonna have sort of a staggered stance, and again, the dumbbell's on the other side. And then I'm gonna have my hand on the hip and drop my back knee straight down. So it's kind of like doing a lunge, but I'm in place, I'm not walking forward. So this is called a split squat. So again, think about that back knee going straight down. This leg is doing the work. I'm pushing and controlling with my front leg. So on the way out, you can think about pushing down with your heel and going up, and then slowly controlling the eccentric. Having the weight in the opposite hand requires my glutes on my left side to work pretty hard. So this is a great one for strengthening gluteus medius and minimus and their tendons. Of course, it's also going to work gluteus maximus, my quads. It's going to work other muscles, but it's a great one for challenging those tendons and building strength through my entire lower extremity. Okay, so that's the split squat with contralateral loading. Again, 3 sets, 10 to 15 reps. You guys, those are some of the top 4 exercises for gluteal tendinopathy. Again, it's pain out there on the side of the hip. If you have any questions about any of these exercises, please leave them in the comment section and I'll get back to you. All right, you guys, see you next time. Bye.